and welcome back to my YouTube channel. I'm super excited to be treating patients with some, I suppose, new products, but the concept of these products have been around for some time. We're going to be doing some fillers today, as well as restructuring the middle layer skin, the dermis, stimulating collagen, elastin, fibroblasts, hyaluronic acid. So we're doing combination treatments, and that's where things are going now. It's not like a one treatment modality or botulinum toxin can fix everything, which it can't. People are now on about, being holistic about their treatments, holistically treating themselves and the face. And I'm super excited to be having Caroline with us today. She's been my patient for a few years, and it was maybe a month ago. The last treatment you had was a PRF, so it's been a while since we've seen Caroline as well, but it's nice to have her back. So I'm glad to be seeing her today, and her main concern is the area around her eyes, and without over treating with botulinum toxin, because I think a lot of people also feel like coming every 4 months to repeat it can be a bit much. So to strengthen the skin and the structure around the eyes, the mouth, so you need less of those treatments. There was also many years ago you had but it's very much improved, like a chemical burn on the chin, and we'll also be doing some treatments around that. And while I'm injecting, I'll explain some of the things we'll be doing. So let's get to it. The first thing we'll be doing here on Caroline is the chin. So I noticed that the chin is a little bit receded. That does happen normally with age, and there's also a bit of tightening due to the scarring. So with the entire treatment approach on Caroline, it's almost like a bone to skin. So we're starting with the bone, the structure, or the subcutaneous layers at least, and we're building on there, and then we're going to move up to improve the quality of skin and the epidermis as well as the dermis. So this is a really thick, intense filler, and it is rightly called intense. You feeling okay there, Caroline? You might just feel a little bit of pressure, and often when fillers injected, you can hear like a sort of noise. This is a really nice structural filler. You can also go down on the bone here with a needle. I prefer using the cannula. So you get like a nice smooth transition. In this area, we're also going to use something called Redenex a bit more superficially, and it's like a tripeptide, multipeptide. I wouldn't call it a serum, like a complex for also restructuring the dermis, helping collagen and elastin. It's like redensifies the dermis, gives it its strength back. Also, there's a little bit of asymmetry here, so as much as we can to correct the symmetry of the chin. Previously, and I think it's probably still the same because of social media, aesthetic medicine goes through trends. And at one time, the chin was a so-called trend, which is wrong, because you're supposed to look at the face holistically. And it was like a trend to just do the mid-face. Like, people were all about cheeks. I suppose lips, I don't think lips will ever go out of so-called fashion. And then people will have these weird overfilled cheeks and then hollow temples, and then they realize that the lower face is very aging. When a lot of patients complain about, like, I look sad, or I look like this, and people are guilty of this. When you see a person, you judge them. And even if it's the nicest man or woman, because their mouth is downturned, they look angry, they look grumpy, so and they're probably not, they're really nice people, but they just look that way. So, it's not only about like the vanity of a line, it's correcting or improving something called emotional attributes. So when you look in the mirror, you see something more positive, you feel more positive, and if you interact with people, they also have a certain reaction to you, and it feels so superficial, but it really is sad that it's true. That looks great. So chins take a lot of filler. We can probably do more, but you know what? It's important not to put pressure on the area. Our face is delicate, there's a balance. So sometimes overfilling or overdoing it increases your risks of adverse events. So Caroline can always come back a couple of months to build the chin further. But I'm pleased for what we're doing now. Plus we're going to also do a lot of things on the skin. So it's not to stress the face too much. Now what we're going to do is we're going to do almost like a pan facial rejuvenation, but using a filler called Global. It's also from Meso Aesthetics, so it's like a little step down from the intents that we use to build the structure of the chin. So it's going to be a little bit more superficial, and the whole purpose of it is to provide like a strut for the skin. And in between this Global filler, we're going to put NCTC. I always have to think about how I'm saying this, because there's another product from Filmed called NCTF 135HA. This is NCTC 109, but it's very similar hyaluronic acid products with a multitude of minerals and vitamins and peptides that basically restructure the skin. So that's what we're doing, but we can also use it in the hair, which I am going to do on one of the patients in another video today as well. Smile again. So I want to go all the way down like a fan, like that, while also getting those smile lines of crow's feet, creating a bit of structure as well as support for the area. You okay there, Caroline? You'll just feel a little bit of pressure. There's a thinner one called periocular in the same range. So for very much younger patients, as a preventative, you can do the same thing with periocular filler. So people maybe in their late 20s that are starting on their aesthetic journey would also benefit from something like this. And as you can see with this filler, a little goes quite a long way. We use a similar technique when we do hyperdilute calcium hydroxyapatite, so to create like a skin boosting effect. The nice thing about this HA filler, the tech is called HA Density Matrix. It has very little BDDE, so that's a cross-linking agent. That often is the culprit when there are concerns and issues like immunogenic issues with fillers. Okay, so now this is the NCTC going in, same entry point, but sort of in between the filler. Also, if you want, you could mix the two. Like you dilute the filler with this and create a new type of hybrid skin booster. And if you smile, you can see it's more structured. Yeah, without the botulinum toxin. So yeah, nice. My pleasure. Thank you guys for joining me today on my YouTube channel and for this video where we did a multitude of treatments. If you have any questions on what was used, how we did it, what was actually done, please pop them down in the comments below. Like, share and subscribe. Bye.